Right, so this is my fourth and final video. My name is Abby Phelps, and in this video we will be going over pulmonary rehab, education, and self-management for COPD patients. Right, so first we'll be going over pulmonary rehab. Pulmonary rehab, what does pulmonary rehab do for your COPD patients, and what are the benefits? So we will be going over in this slide what pulmonary rehab does. So first, it improves exercise tolerance, so it increases the ability to perform physical activities without excessive breathlessness. It reduces dyspnea, so shortness of breath, difficulty breathing, and makes breathing easier and more comfortable during activity and at rest for your patients, because a lot of them do struggle with that. Teaches breathing techniques, so provides strategies to manage breathlessness and conserve energy. It strengthens respiratory muscles, improves the strength and endurance of the muscles involved in breathing. It provides education for your patients, offers information about COPD, medications, and self-management strategies. Offers nutritional counseling, so provides guidance on healthy eating habits to maintain a healthy weight and optimize energy levels. It provides psychological support, addresses anxiety, depression, and other emotional challenges associated with COPD. Like I talked about earlier, a lot of the patients that have COPD, they'll get depressed, sad, and a lot of it's just due to not being able to do the things that they were once able to do, getting shortness of breath, and having constant cough, and even doing little things like going to the grocery store or whatnot. They get out of breath, so it's very hard for them to mentally take on the things that comes with COPD. So it's really important to help address their anxiety, depression, and other things that they may have with COPD. It improves medication adherence, so encourages patients to take their medications as prescribed. It enhances self-management skills, empowers patients to take control of their COPD and make informed decisions about their care, such as smoking cessation, not smoking anymore. Um, so yeah. Right. So here are the benefits of pulmonary rehab. So improved quality of life. So it enhances your patient's overall well-being and satisfaction with life. Increased functional capacity. So it improves the ability to perform daily tasks and participate in activities. It reduces hospitalizations, decrease the likelihood of needing hospital care for COPD exacerbations, decrease healthcare costs, reduce the overall costs of managing COPD. So some patients might not have to wear oxygen as much as they used to, or saving them money from not having to go to the hospital as well. Improve survival, so may increase lifespan in some patients, reduce anxiety and depression, so it helps with the emotional distress associated with COPD, like we talked about. Increase confidence, it empowers patients to live a more active and fulfilling life. Better sleep quality, it improves sleep patterns and reduces nighttime breathlessness, and it enhances social interaction, so provides opportunities to connect with other people with COPD and share experiences. So symptom control. So breathlessness, severity, changes in triggers. So these are things that you really have to watch for. So cough, you need to pay attention to frequency, severity, mucus production, sputum, amount, color, consistency. So activity limitations, so how your COPD affects your daily task. Sleep, so difficulty breathing, coughing at night. Your mood, anxiety, depression, exacerbation signs, increased symptoms, fever, medication side effects, so new or worsening issues, and weight, so unintentional changes. So these are things you have to really pay attention to for your symptom control, little things that you notice and that you need to tell your doctor on your checkups. So ways that you can like control your symptoms, excuse me. So increase bronchodilators, so using short-acting inhalers more frequently, such as your SABAs and your SAMAs. Oral corticosteroids, excuse me, words are hard. Take prescribed oral steroids as directed, antibiotics if needed. So take them if they are prescribed for suspected bacterial infection, which can be increased sputum and change in color in your sputum. Oxygen therapy, so use supplemental oxygen if prescribed to maintain oxygen saturation, which we'd like to have it about 88% to 92%. Stay hydrated, so drink plenty of fluids to help thin your mucus. Rest, get adequate rest to conserve energy. Monitor symptoms, so track symptoms closely and report worsening to doctor, such as we talked about just a second ago. Follow action plan so adhere to the COPD action plan provided by their healthcare provider and seek medical attention. So go to the doctor or emergency room if symptoms worsen significantly or don't improve. Right, so gold standard for oxygen. So the gold standard for prescribing long-term oxygen therapy in stable COPD patients relies on their ABG measurements. It is indicated, long-term oxygen therapy is indicated if the PaO2 is less than 55, or the SaO2 is less than 88% at rest on room air. It is also considered if the PaO2 is between 55 to 60, or the SaO2 is less than 89% with evidence of pulmonary hypertension, peripheral edema suggesting heart failure, or polycythemia. While pulse oximetry can screen, ABG is preferred for accuracy reasons. Oxygen flow should be titrated to achieve a target SaO2 of at least 90%. Regular reassessment is crucial to ensure continued appropriateness and effectiveness. Smoking cessation is paramount for all COPD patients, especially those on oxygen. Long-term oxygen therapy, when appropriately prescribed, can improve survival and reduce pulmonary hypertension and enhance quality of life. The decision to prescribe long-term oxygen therapy should be individualized, considered patient's overall condition and goals. Different oxygen targets and management strategies apply during acute exacerbations. So gold standard for ventilatory support. So your non-invasive is your first line of therapy. It is preferred initial treatment for COPD exacerbations with respiratory failure. The benefits, it reduces intubation, improves gas exchange, and eases breathing. You do invasive mechanical ventilation if non-invasive fails. inva- invasive mechanical ventilation is used if non-invasive doesn't work or it was not appropriate. Oxygen with ventilation, so supplemental oxygen is given both non-invasive and invasive to maintain an SaO2, typically 88% to 92% during exacerbations. Long-term care or long-term non-invasive, some stable COPD patients with chronic hypercapnia may benefit from long-term non-invasive ventilation. Individualized approach. So ventilatory support decisions are based on the patient's condition. Everything varies from patient to patient, so it really depends. Right, so surgical interventions. Here's a couple of surgeries and their benefits that come from it. So lung volume reduction surgery. So this removes diseased lung to improve breathing for severe emphysema. Upper lobe dominant. So the benefit, it improves lung function and your patient will have less breathlessness. So BLVR, bronchoscopy, lung volume reduction. This is minimally invasive. Valves collapse, disease lung areas. This is less invasive and it improves breathing. Lung transplant replaces diseased lungs for very severe COPD, and the benefit and improved lung function, quality of life, and also survival for your patient. An embolectomy, it removes large air sacs, compressing the lung, and the benefit of this is reduced breathlessness and prevents lung collapse.